topics as well as quick revision of volatile topics. And also we will be covering all high-yielding topics like which are frequently asked in all the university exams, which will be covered here. So this is beneficial for the exams of all the state universities. And you can use the code Dr. Divya 20 for the first free live class. So today's class, we will be covering some of the head and neck topics, some long essays like scalp, facial nerve, and also some of the osteology and scalp and face region. And you can use the code Dr. Divya 20 for the discount on subscription. So here the core features of Auricle include live classes, recorded classes, which you can access anytime, anywhere. And we also give you notes which are comprehensive, which is actually a comprehensive notes with all CBME-based question and answers. It also has MCQs. And the MCQs are from beginner level to expert level, where you can assess yourself. And they are all the standard multiple choice questions, which are frequently asked in the exams. We have 3 subscription plans, the basic for 3 months, standard for 6 months, and mentorship program for 12 months. And this is a wholesome program, which we are giving you at a special discounted rate of 50,000. So here the services include especially the one-to-one personalized guidance as well as notes, which are the additional benefits of this mentorship program. And you can use the code Dr. Divya 20 for the discount on subscription. So you can book a slot for personalized counseling session. And you can use the code for the first free live class. So we shall begin with today's class. So we'll begin with the osteology. So before we understand the other things, let us go through the osteology part of it. So first is ethmoid bone. Now, ethmoid bone is just basically present within the nasal cavity. So here it is between the nasal bone, okay, nasal bone and the orbit. So you can see it here. So it is present in this region. Okay, right. So this is the ethmoid bone. So here the lamina pepraceae, it separates this ethmoid bone from the orbit. Okay, so basically between the nasal bone and the orbit, you'll be seeing this. So here the perpendicular plate of this ethmoid bone, okay, so here you can see this is the perpendicular plate of ethmoid bone. This will be forming, that is the medial wall of the nasal, means it contributes basically to the medial wall of the nasal septum. And here you can see the roof portion above. This will be the roof where it is formed by the cribriform plate of ethmoid bone. So why it is called cribriform is it has got many sieve-like. Cribriform means sieve-like. Okay, so sieve-like holes through which the that is olfactory nerves will be projecting into the cranial cavity to form the olfactory bulb. So there are 2 elevations in the lateral wall. Here you can see in this lateral wall, or here you can see the lateral wall, there will be 2 elevations, which are called the middle turbinate and the superior turbinate, okay? So middle and the superior, that is, otherwise we also called it as the concha. Okay, so these are contributed by the ethmoid bone. So ethmoid bone will have a cribriform plate, will have the perpendicular plate, as well as the 2 turbinates, that is the superior and the middle turbinate. Then there is the uncinate process. Okay, uncinate process will form the osteomeatal complex. Okay, uncinate process, which is not seen here. Okay, so and hiatus semilunaris, it will open between. That is when we take a section. Okay, section of the nasal cavity. You can see that hiatus semilunaris. So that will be opening between the uncinate process and the bulla ethmoidalis. So bulla ethmoidalis, you will see it in the middle meatus, an elevated part. Okay, so that is called as the bulla ethmoidalis. And hiatus semilunaris will be a semilunar opening just below the bulla ethmoidalis. So those are the spots where these sinuses, okay, paranasal sinuses will be opening there. So the superior and middle turbinate. So only those 2, but there is 3 turbinates, superior, middle and inferior. Inferior turbinate is an individual bone. Only the superior and the middle, they form part of the ethmoid bone. Okay, so next we move on to vomer bone. So vomer bone Okay, here you see Omer bone is a mid-sagittal bone, which is an unpaid. It is a single bone. Okay, it is not a paid bone in the skeleton, facial skeleton. So this will be, Omer will be articulating with the unpaid sphenoid and ethmoid. So here, this is the sphenoid bone here. Okay, and here we have the vomer bone. This is the vomer bone. This is the perpendicular plate of ethmoid. Okay, so it will be articulating with the unpaid sphenoid and ethmoid bones, as well as with the paid bones. Paid bones are the maxilla and the palatine. Palatine below. So with the maxilla, see maxilla here, and with the palatine, it will be articulating. So you can, this blue thing is the vomer bone. The superior part here, the superior part of the nasal septum, we saw earlier that it was formed by the perpendicular plate of ethmoid. Whereas the vomer bone, though, it has, it will form the inferior part of the nasal septum. And vomer bone on either side will have a nasopalatine. So we actually, in the base of the skull, we will be able to see that, okay? In the base of the skull, on either side of the vomer bone, there is a small groove, okay? That is called as the nasopalatine groove, where the nasopalatine vessels and nerves will be passing through it. And the vomer bone superior part is called as the wing of the vomer, okay? So in the skull, in the base of the skull, you will be able to see that, okay? So vomer bone, the superior part will be like, spreading like this, like two wings, okay? So that is, and that receives the rostrum of the sphenoid, okay? Rostrum of the sphenoid, and will be forming the wedge kind of, that is the joint, it will be forming wedge and groove, okay? So this is rostrum. So if the, then the inferior border, here, if you see the inferior border will be articulating with the maxilla and the palatine bones. So anteriorly, it will articulate with the perpendicular plate of ethmoid. So you can see this is the perpendicular plate of ethmoid. And the lower half will be grooved with the inferior margin for septal cartilages. Here, this portion will be is grooved with the inferior margins. They are for the septal cartilages of the nose. Then we have zygomatic bone. So zygomatic is this bone, okay? So zygomatic bone is the cheekbone, we say, right? Or it is also called as the malar bone. So this is a paid bone. Along with the facial skeleton, if you see maxilla, here we have 2, the nasal bones are 2. Okay, so this is also 2. So this is the zygomatic bone. So the zygomatic bone, it is present in the upper and lateral part of the face, and it will form the prominent part of the cheek, okay, as well as part of the lateral wall of the facial skeleton. So it will also form part of the that is lateral wall, as well as the floor of the orbit and a portion of the temporal and infratemporal fossa, because it is in this region. So you can see it will form the part of lateral wall as well as the floor of the orbit. Here you can see, and it also parts a part of the, this is the temporal fossa, and below will be the infratemporal fossa. So the malar surface of the zygomatic bone has got one foramen that is called as the zygomaticofacial foramen. Here it will be present, okay? Zygomaticofacial foramen. And that will give passage to the, that is, it forms a path for the passage of zygomaticofacial vessels and nerves. So below the zygomaticofacial process, there will be a slight elevation, okay? So this elevated portion will give rise to the zygomaticus major, zygomaticus minor. Those muscles will be arising from there. Then the temporal surface, it will form the temporal fossa, and also the zygomatico foramen is present near the center of the surface. Okay, so here the temporal surface of the zygomatic bone will be in this side. Okay. And that gives passage to the zygomatico-temporal nerves will be passing there. Then the orbital surface has zygomatico-orbital foramen through which the zygomatic nerves will pass. So the zygomatic bone processes, so it has got for 3 processes. So you can see here the frontal process, the temporal process, and this is the zygomatic, maxillary process. Okay, the part which is coming towards the maxillary process, upwards will be the this one will be the frontal process, and here will be the temporal process. Okay, so the orbital surface of the frontal process of the zygomatic bone, it will form the anterior, that is, here you can see, the orbital surface here of this orbital surface of the frontal process of the zygomatic, means the inner surface of this is the frontal process, so inner surface of this, okay. So it is forming a part of the lateral wall, okay, that is what it says. And along with that, there will be small foramina there, okay, they are called as the zygomatico-facial foramina, which will be opening on its lateral surface. So the temporal process of the zygomatic bone here, it forms the zygomatic arch along with the zygomatic process of temporal bone. So both of them, they join together, they will form that is, they articulate together and they form the zygomatic arch, okay. And on the medial, okay, deep surface of the bone, there will be a pair of zygomatico-temporal foramina. And the orbital surface of the maxillary process of the zygomatic bone forms a part of the infraorbital rim. So you can see here, this is the part of the infraorbital rim. Okay. Then the zygomatic bone, it usually develops by the 8th week of fetal life and it fuses by 5th month of fetal life. Okay. So this is how it is when you see individually. Excuse me. So this is the zygomatico-facial foramina you are seeing. This is the frontal process, this is the temporal process, and this is the zygomatic process. Okay, so this is the tubercle on the inner side, which forms a part of the lateral wall, that is known as the Wittnall's tubercle. Then here you can see the zygomatico-orbital foramina, and here this is the inner temporal surface, okay, which will be on the inner side. Okay, there you will see the zygomatico-facial foramina and zygomatico-temporal foramina. Okay, so those are the small foramina which we see on the temporal surface of it. Then coming to the lacrimal bone, it is a small bone which is located in the face, okay, lacrimal bone. Okay, so it will form a part of the medial wall of the orbit. So it's a very small bone here, inner surface, you can see. So this lacrimal bone, as I said, it forms the medial wall of the orbit. Okay, it has got 2 surfaces and 4 borders. So the anterior-inferior depression in the lacrimal bone, it is called as in the lacrimal bone, it is called as the lacrimal fossa. Okay, so that will house the lacrimal sac. So that lacrimal sac will be present within that depression. Then what happens is usually the tears, okay, the secretions produced by the lacrimal gland, they are collected in that lacrimal sac. And the lacrimal fluid passes into this lacrimal duct and then it flows into opens into the nasolacrimal duct, and it will actually opens into the inferior meatus of the lateral wall of the nose. Okay. Then the lateral surface, lateral surface is otherwise called as the orbital surface of the lacrimal bone. It has posterior lacrimal crest, and it has 2 crests, okay, posterior and the anterior part. So posterior lacrimal crest is divided into 2 parts. So front of the posterior lacrimal crest, we call it as the lacrimal sulcus. Okay, so this will unite with the frontal process to form the lacrimal fossa that will be on the inner surface. The portion behind the posterior lacrimal crest is smooth, okay, and it forms the medial part, that is of the orbit. The medial surface of this will form the middle meatus, okay, middle meatus, that is of the lateral wall of the nose, middle meatus part, it will contribute. So the lacrimal bone anterior part will articulate with the frontal process. So here, okay, frontal process of maxilla, and superior part will articulate with the frontal bone, okay, as well as posterior part with the lamina papraceae of the ethmoid. The inferior part is divided by the lacrimal crest into 2 parts. The posterior part will articulate with the orbital plate of maxilla, and the anterior part will articulate with the inferior nasal concha, okay. So it is here, inferior nasal concha is the last turbinate, which we see it in the lateral wall of the nose. Okay, so that is about the lacrimal bone. Okay, so this is the lacrimal bone you can see here. Okay, So this is the part. This is actually the orbit. So this is where the crests are. You can see this portion. Then mandible. Okay, so mandible is an important bone. So mandible is a jaw bone which is mobile and it makes up the, that is basically it forms the lower part of the jaw. So here if you see the mandible, it is like a horseshoe shaped. It has a horseshoe shaped body and two ramus. Okay, this is known as the coronoid process. This is called the condylar process. The body here will have an outer surface and an inner surface. Okay, this is the inner surface of it. This is the outer surface of it. Okay, inner surface and outer surface. So here if we see in the center where the two, basically when they are formed separately, two on the right side and the left side, and they both fuse in the center. Okay, where the fusion, at the point of fusion, we call it as the mental protuberance. And just lateral to that, there will be a foramina, which is called as the mental foramina. Okay. And on the inner surface here, we see this groove, this line. This is known as the mylohyoid line. And below and behind this mylohyoid line, there is a fossa that is for the mandibular gland. And here we have above and anteriorly here, no, this one, this portion. Here we have the fossa for the sublingual. Okay. And here there is a foramina, which is called as the mandibular foramina, through which the inferior alveolar nerve and vessels go. And this will be covered here. There is a tongue-like process, which is called as the lingula, where the spinomandibular ligament is attached. Okay, so that is the thing. And this is the coronoid process where, condylar process, which will be articulating with the temporomandibular joint. This is coronoid process, and to the coronoid process, the temporalis muscle will be attached. And to the lateral part of the ramus, we have the masseter muscle attached. Okay. So this is the mandible which you see. Okay. Okay. So nasal bone. So nasal bone here, okay, which is the nasal, there are a pair of nasal bones. Okay. So nasal bone is situated on the face and it forms the upper 1/3 of the nose. Basically the cartilage, the bony part is formed by this nasal bones. Okay, so pair of these nasal bones, they are joined together by the suture that is called as the internasal suture. So that forms these nasal bones, they form the bridge of the nose. So over this nasal bones, the muscles, that is the procerus muscle and nasalis muscle is attached. And its inner surface of the nasal bone, there is a groove through which the nasociliary nerve will pass. So the nasal bone, it articulates with the frontal. If you see here in the front, it's articulating with the frontal bone as well as ethmoid bone on the inside, right? And in the face, it will be articulating here down with the contralateral, that is on its opposite bone, okay? The similar bone on the right or on the left, as well as in the maxilla, it articulates. So this nasal bone, it forms a number of connections with the surrounding bones of the skull. So in that way, like it is since it is articulating with the different bones, it is forming connection. So the superior border of this nasal bone, it connects with the nasal part of the frontal bone, forming the frontonasal suture. Laterally, the nasal bone is connected to the frontal process of the, here you can see, frontal process of the maxilla via the nasomaxillary suture. Its inferior border will be here. This is the inferior border, and inferior border will be attached to the cartilages. That is the lateral nasal cartilages. It is attached. Okay. Next important thing you need to know is the foramina. That is very important. It is asked as a spotter. Some of the foramina, they are also asked as a 3-mark question. Okay, so optic canal. So optic canal, the optic nerves and vessels. So in the base of the skull here, in the front, you will see the optic canal. Okay, so the optic nerve and the ophthalmic artery, okay, will be passing through that. Then there is superior orbital fissure on either side, that is between this lesser wing of the sphenoid and the greater wing of the sphenoid down. No, there will be a fissure which is called as the superior orbital fissure. Now, this superior orbital fissure, no, is divided into 3 parts: the medial part, the intermediate and the lateral part. So in the medial part will be the inferior ophthalmic vein. Okay, inferior ophthalmic vein will be passing through the medial part. Whereas in the middle part of it, we have the upper and lower divisions of oculomotor nerve. And between those two divisions, the nasociliary nerve will pass. And below and lateral to the lower division, we will have the abducens nerve, which will be passing. And in the medial part, okay, the lateralmost part, we have the superior ophthalmic vein passing, okay, superior ophthalmic. So there is, see, in the medialmost part, there was only one vein. In the middle part, basically, this is divided into these three parts by the tendinous ring of Zinn, where the extraocular muscles will have the origin, okay. So in that middle part, all nerves, okay. Whereas in the lateral part, there is vein, there is artery, there is nerve. So the vein there is the superior ophthalmic vein. The artery there is the recurrent meningeal branch of lacrimal artery. And the nerves there are the frontal nerve, remember LFT, okay. So lacrimal, frontal as well as trochlear. Foramen rotundum now. Foramen rotundum here, you see it in the interior. You don't see it in the base. You see it in the only in the cranial cavity, this foramen. Okay. So that is because it will communicate with the fossa, pterygomaxillary, this palatine fossa. So because it communicates there, it doesn't open down into the base. So that is there the maxillary division of trigeminal nerve will be passing. Foramen ovale. To remember what structures pass through foramen ovale, remember the mnemonic MALE, M-A-L-E. M is for mandibular division of trigeminal nerve. Then A is accessory meningeal artery, L is lesser petrosal nerve, and E is emissary vein. Then we have foramen spinosum. Foramen spinosum will be just behind the foramen ovale. Okay. So here this is the foramen ovale. And behind that will be the foramen spinosum. Okay. So foramen spinosum, middle meningeal artery, middle meningeal vein, and nervus spinosus. That is the recurrent meningeal branch from the mandibular. That will be present there, passing through that. Okay. Foramen lacerum, the deep petrosal nerve, meningeal branch of ascending pharyngeal artery. So lacerum will be on either side of the body of the sphenoid. Okay, so that will be passing, and emissary veins will be passing. Carotid canal, the internal carotid artery and the venous, that is sympathetic plexus will be present around that. Okay, so that is carotid canal will be here. Okay, and then you have to know jugular foramen. So jugular foramen, again, it has three parts. Okay, the anterior, middle, and the posterior. In the anterior part, it is the inferior petrosal sinus. Okay, and meningeal branch of ascending pharyngeal artery will be passing. That is in the front, inferior petrosal sinus and meningeal branch of ascending pharyngeal artery. In the middle part, the cranial nerves, that is 9th, 10th, and 11th cranial nerves, whereas in the posterior part, middle meningeal branch of occipital artery as well as the sigmoid sinus, which will continue as the internal jugular vein will be present or passing through that. Hypoglossal canal. Okay, so here will be the jugular foramen. Hypoglossal canal is situated here. So hypoglossal canal will be hypoglossal nerve. Will be passing through that, okay? And foramen magnum, that is the largest foramen magnum here. So basically the lower part of the medulla will be there with all the meningeal coverings. Fourth part of the vertebral artery with the sympathetic plexus, spinal part root of accessory nerve, anterior and posterior, okay, one anterior and two posterior spinal arteries will be present. Cerebellar tonsil. Cerebellar tonsil is that portion, okay, down near the cerebellum. That is in relation there. Okay, so okay, so there is the pterygopalatine fossa. So pterygopalatine fossa, if you see here, this is the fossa here, okay? So pterygopalatine fossa, it is like a teardrop-shaped space which is present between the bones on the lateral side of the skull, okay? So it is immediately posterior. If you see here, it is posterior to the maxilla and medial to the pterygomaxillary fissure. It will be medial to the pterygomaxillary. This is the pterygomaxillary fissure is there, okay? So that will lead to the pterygopalatine. So this is the pterygopalatine fossa, and this side will be the nasal cavity. Okay. So it will lead to that through the spinopalatine foramen. So the relations of it, when we see pterygomaxillary fissure, so the fissure will be laterally, the greater wing of the sphenoid will be superiorly. The pterygoid process here, this is the pterygoid process, that is seen posteriorly, and the perpendicular plate of palatine bone will be medially, and pyramidal process of palatine bone will be inferiorly. Okay. So that is in relation to the palate in that region, we will see that. Okay. So that is about that. Then skull. Skull is what now? It is a protective covering of the brain. Okay. So this is the skull. So skull is made up of neurocranium and viscerocranium. So human skull as neurocranium that surrounds the basically the okay, that has as neurocranium. Basically, what it means is it will cover up the brain and the spinal brain part. Okay, so basically the central nervous system, no, brain and the brainstem part, it will be covering. The upper areas of the cranial bone, they form the calvaria, and the membrane is viscerocranium. Okay, so this is the viscerocranium. We say viscerocranium will give rise to the mandible. Okay, so the skull bones, except for this, that is the mandible, they are formed by synarthrodial joints. Synarthrodial joints means they are immovable joints. Okay, that is the sutures. No, they are all joined by these joints, which we call them as the sutures. So they are immovable joints. Okay. So Wormian bones, sometimes what happens, separate extra bones, no, will be seen. Okay. So they are known as sutural bones, and they lie within the sutures, wherever this joint is. So in that part, there will be Wormian bones. So they usually, we need to be aware of Wormian bones because they can be sometimes, what is that? When the X-ray is taken, it can be mistaken for fractures. So skull has altogether, when we count, it has got about 22 bones. So there are about 8 cranial bones. Okay, the cranial bones, which basically form the vault of the skull, they are 8, and about 14 facial bones. Okay, and the two processes include the mastoid process here and the zygomatic process. So when we study the skull as such, we study the different views of the skull. Okay. So when we see it from above, we call it as the norma verticalis. So norma verticalis is the view of the skull from above, upper aspect. So it appears oval. Okay. So when we see it from above, it appears oval, wider posteriorly than anteriorly. So what bones do we see? We will see the, from anterior to posterior, we see the frontal, the parietal, and the occipital. Okay, and these bones, they are all joined together, or they articulate with each other by sutures, which is in front we have the coronal, between the two parietal we have the sagittal suture, and behind we have the lambdoid suture. Okay, metopic suture is, we see it in the early stage, that is in children, neonates we see before the frontal bone is single. But that time the frontal bone with metopic suture, they joins the two parts of the frontal bone. But later on, the frontal bone, it fuses, it ossifies, it forms a single bone. Okay. So where this coronal and the sagittal suture meet, no, that point is called as the bregma. So in fetal life, it will be represented fetal, and in the neonates also, it represents the anterior fontanelle. Okay. And anterior fontanelle, it usually closes by 18 months of age. Lambda is the meeting point of the sagittal and the lambdoid suture, and that represents the posterior fontanelle, which is actually the first one to close. Okay. So it closes by 2 to 3 months of age. Then obelion is a point in the sagittal suture. Okay, so it will be in the sagittal suture between two parietal. Okay, between the two parietal bones. So vertex is the highest point on the skull, and it lies in the midline of the sagittal suture, which okay, and is just behind the bregma. So parietal foramina are present on either side of that is in the parietal bone. Okay, basically for the passage of emissary veins. So you can see here. This is the sagittal suture. This is the coronal suture. Here you will get this point is bregma. This is the highest point. This is called as vertex. Then here we will have the parietal foramina. This elevation, we call it as the parietal eminence. Okay. And where this lambdoid suture and the sagittal suture will meet, we call it as the lambda. Norma occipitalis, when we say norma occipitalis is the convex upwards and on each side. Okay, so norma occipitalis is the posterior view of the skull. Okay, so okay, so here so basically the view, what you have to know is what is the view, what is the name of the view, and which view it is. Then what are the bones you are seeing and any features there. Okay. So here in norma occipitalis, when we view the skull from posterior part, it is called as the norma occipitalis. So what do we see there? Which are the bones we see? We see the posterior part of the parietal bone. Then the upper part of squamous part of occipital bone is seen. And the mastoid part of the temporal bone is seen on either side. Okay, so the sutures in this norma occipitalis, what are the sutures we see? So we see the lambdoid suture, right? We see it between the occipital bones and the two parietal bones. Sutural, sutural bones means the Wormian bones, okay? So Wormian bones, we commonly see it in that lambdoid suture sometimes, okay? And the occipito, okay, here you see, this is the thing. And yeah. The occipitomastoid suture, that is between the occipital bone and the mastoid part of temporal bone. The parieto-mastoid suture is present between the parietal bone and the mastoid. Okay, so here, the occipitomastoid, this one, this is the parieto-mastoid. Okay, this is the parieto-mastoid here, and this is the occipitomastoid. And the mastoid foramen is okay, so that is the thing. Then here you see the highest point, that is called as the external occipital protuberance, and that is a prominence here you will see in the norma occipitalis, and on either side of that there is the two prominent lines which we call it as the superior nuchal lines. Okay, superior nuchal lines is there. So the occipital point in the okay, so you have to know the most prominent point on this protuberance. Okay, that is the external occipital bone prominence is there, right? Protuberance, the most prominent or the highest point on that, we call it as the inion. Okay, and the glabella is actually situated in the front. Okay, glabella is situated in the frontal bone. This is situated inion, that is the highest point on the external occipital protuberance. So the mastoid foramen is located on the mastoid part of the temporal bone. Near the occipitomastoid, there will be a small foramen here, that is the mastoid foramen. Okay, so that will be opening into the sigmoid sulcus. So the mastoid foramen, basically there is an emissary vein, okay, and the meningeal branch of the occipital artery. So here norma occipitalis, we will see near the mastoid process, we have the attachment of sternocleidomastoid. From the superior nuchal lines, we have the trapezius, as well as the occipitofrontalis muscle. They are some of the attaching muscles we see in the relation to norma occipitalis. Then we have norma frontalis. So norma frontalis is which view is norma frontalis? As the name says, it is from the front. Okay, when we view the skull from the front, we call it as the norma frontalis. So this is wider above than below. So here what bones are we seeing? Okay, so what bones we will see in the face, in the front, from the front, we will see the frontal bone, we see the nasal bones, we see the zygomatic bone here, the maxilla here, right? We see that. We also see the mandible, right? So there are the other bones. So the frontal bone forming the forehead, the right and left maxilla of the upper jaw, the right and left nasal bones which form the bridge of the nose, the zygomatic bones, then the mandible. These are the bones of the facial skeleton, that is norma frontalis. Then we also see the superciliary. Okay, so superciliary arch is above here. Okay, above the orbit, there will be a prominence that is called as the superciliary arch. So it is curved elevation seen just above the medial part of each orbit. Then the glabella, see here, the glabella is the median elevation here. Okay, elevated part of the frontal bone. is glabella. The nasion is the meeting point of the root of the nose where the internasal sutures. So here, near the root of the nose, where the frontal as well as the nasal bones meet, no, that point is the nasion, okay? Nasion. And the frontal tuber, it is any eminence at the lower, it is actually a low rounded elevation above the superciliar arch, okay? Above here, there will be two elevated parts that is known as the frontal tuber. Then the supraorbital margin here, if you see, it is formed by the frontal bone. The infraorbital margin is contributed by two bones, that is the zygomatic as well as the maxilla. So here, the lateral orbital margin, okay, here if you see, the lateral orbital margin is mainly formed by what? The zygomatic bone, okay, frontal process of the zygomatic bone, it forms the lateral orbital margin. So these are the bones in the norma frontalis. Then we have the norma lateralis. Norma lateralis, when means what? When you define what is norma lateralis means when we view the skull from the lateral side, we call it as the norma lateralis. So here, what are the bones? So when we see from the front to back, you have to go it in an order from the front to the back, what bones we are seeing. Okay, so there is frontal bone, right? So this is the frontal bone. Here is the zygomatic bone. This is this brown thing here, okay? That is the greater wing of the sphenoid. Behind, we are seeing the parietal bone. Then we are seeing the temporal bone and a portion of the occipital bone. And front here, if you also see, we will see the nasal bones. Then here we have the maxilla as well as the mandible, right? So those are the bones which we see it in the norma lateralis. So the posterior part of the infratemporal. So here we see two lines. One is the superior temporal and below that will be the inferior temporal line, okay? Then the external acoustic meatus here. This opening, we call it as the external acoustic meatus. And the suprameatal, okay? So this is important. The suprameatal triangle is just posterior superior to this external acoustic meatus. There is a depression, triangular depression. That depression is known as the suprameatal triangle, okay? So the mastoid part of the bone lies behind the external acoustic meatus. Here you can see. Okay, and here we also see the styloid process. It is a thin, long projection from the norma basalis. So the apex or tip, okay, so basically it's tip. Because of the presence of this ramus, sometimes we will not be able to see the tip of it. And above the zygomatic arch, above we see the temporal fossa and below will be the infratemporal fossa. Then the last view we see is the norma basalis. So norma basalis is the, when we see the skull from its base. Okay, so here, what are the bones we see? We see the palatine process of maxilla and the horizontal plate of palatine bones. Okay, so this is the palatine process of maxilla and the horizontal plates of palatine bone. So as we come back, what are we seeing? The pterygoid process. Okay, so the pterygoid process we are seeing, the horizontal plate I told you, right? Then here, this green thing here is the vomer bone. So this is what I told you that time, the wings. Okay, so this is the pterygoid process. This is the greater wing of the sphenoid. Then we are seeing the temporal bone. This is the temporal bone, and this whole thing is the occipital bone. Okay. Okay, so the anterior part is formed by the hard palate and the arches of the alveolar arches here, no? So they form the anterior part. Okay, the bones. So here, this is the hard palate. It's like a spotter question, a 3 marks question. So what are the bones contributing to the formation of hard palate? So we have the horizontal plates of maxilla and the palatine process. This thing, horizontal, okay, of the palatine process of the maxilla and horizontal plates of the palatine bone. So those, they form together the hard palate. So, so middle part, it extends from here, that is from the posterior margin of the hard palate to up to the foramen magnum. Okay. So here you basically see the sphenoid bone and the petrous part as well as the squamous part of the temporal bone. Okay. So this and the posterior part of the inferior aspect of that is the base of the skull is mainly formed by the occipital bone. So you can see a large foramen here. This is the foramen magnum. Okay. Next is maxilla. So maxilla, it basically forms the upper jaw, which is a fixed part of the jaw. Okay, maxilla. That is one more bone. So it is a paired bone. So there is a right maxilla and the left maxilla. So the two maxillary bones, they are fused here. If you see in the below, here they are fused by the intermaxillary fissure, forming the anterior nasal spine. So maxilla has got a body. Okay, it has a pyramidal shaped, the body is like pyramidal shaped, and it has an orbital, nasal, infratemporal, and a facial surface. Okay, so this will be the orbital surface. What we are seeing will be the facial surface, and below here, posteriorly and behind, will be the infratemporal surface, that is its posterior surface. Another one will be the nasal surface, okay, towards the nasal cavity. Processes, we see the zygomatic process, the frontal process here. This is the alveolar process and the palatine process, okay, which form the hard palate. So the surfaces in the maxilla, which include here are the anterior surface here, the posterior, and towards the nasal cavity side, we have the medial surface. So this maxilla here, no, you should know that it articulates with 9 bones. So you go in an order, okay, which are the bones. From here we will start. So frontal will be there, then ethmoid, okay, that will be on the inner side. Then we have the nasal bone here, nasal, then the zygomatic here, then lacrimal here, okay, inner side lacrimal. Then near the palate, we have the palatine bones, then vomer on the inner side, inferior nasal concha, and the maxilla of the other side. So those are the bones. Okay. So maxilla in facial trauma, maxilla is the commonest bone to get fractured, and Leafoot has classified into 3 types there. Okay. Next bone is the parietal bone. So parietal bone, which is this parietal bone? Parietal bone is in the forms a bone of the cranial vault, isn't it? Mainly. So this parietal bone will have 4 borders. It will have a sagittal border that is in the midline, okay, where it forms a sagittal suture articulating with each other. Then it has the frontal border, which will be articulating with the frontal bone. Then squamous border articulating with the temporal, and occipital border articulating with the occipital bone. So this parietal bone, it will articulate anteriorly with the frontal bone, where near the coronal suture. Inferiorly, it will articulate with the temporal bone at the squamous suture, and posteriorly, it will articulate okay, with the occipital bone through the lambdoid suture. It has a small articulation with the sphenoid, that is with the sphenoid bone through the sphenoparietal suture at the pterion also. So small articulation, okay, not a very significant one. It will be articulating. Then the parietal bone, it also articulates with the other contralateral parietal bone through the sagittal suture. So since it is like a flat bone with 4 ends, right? It will have a frontal angle. It will have a sphenoidal angle below, occipital angle, and a mastoid angle. Okay. This is the parietal. This is what we mean by the angles. So the frontal angle is at the lowest front and is a point called as the pterion. Okay. Mastoid angle is here. This is called as the asterion. Okay. And occipital angle is at the back called as the lambda. Okay. Okay, next is the occipital bone. The occipital bone is a trapezoidal shaped bone which forms it forms the base of the skull. Okay, so this is situated at the lower and the back part of the cranium. So all of you know this is the occipital bone. Okay. So the this thing, which one? The occipital bone, it will be articulating with 6 bones. So if you see here, which shows those 6 bones, 2 parietal bones, 2 temporal, 4, right? Then what are the other bones it will articulate with? Sphenoid and the atlas. Atlas is the first cervical vertebrae, and the sphenoid bone in the front, that is in the base, you will be seeing it will be articulating. So the 4 parts of the occipital bone are the basilar part, the lateral part, and the squamous part. Okay. The basilar part is downwards. So squamous part will be this part. Okay. And the lateral part. So basilar part of the occipital bone, it will extend anteriorly, and it will form, there we will have an foramen, which is known as the foramen magnum. So after that joins with the sphenoid bone in the front. So that is known as the basi-occiput. So basi-occiput will have an internal surface and an external surface. Okay, so when we see here, this thing is not seen. Okay, in the base of the skull, we will be able to see that the basi-occiput part. And also in the cranial cavity, you'll be able to see. So in the cranial cavity, that sloping part, no, in the posterior cranial fossa, that is known as the clevus. And on either side, there will be a groove for the groove on the either side of clevus, which is for the inferior petrosal sinus. Okay. And the external surface will have a pharyngeal tubercle. So what will be attached to the pharyngeal tubercle? A median raphe will be attached, to which all our constrictor muscles of the pharynx will be attaching. Okay. So lateral part of the occipital bone will have 2 surfaces, the internal and external surface. So internal surface, we see the grooves for the sinuses, okay, sigmoid sinus, which is seen in the posterior cranial fossa. The squamous part of this occipital bone, no, that is known as the occipital squama. Okay. So internal surface here will have cruciform eminence, internal occipital protuberance, and internal occipital crest. All those features, we can see it in the base of this thing, interior of the cranium. And it will also have a groove for superior sagittal sinus as well as a groove for transverse sinus. Here, since it is closed, I will not be able to show you. If it's an open skull, you'll be able to see those things. Okay. And then we move on to the temporal bone. So temporal bone is present in the lateral aspect of the skull. Okay. So this temporal bone, it forms a part of the temporomandibular joint. Okay. So this temporal bone has got 4 parts. So which are those 4 parts? Squamous part, petrous part, tympanic part, and the zygomatic, as well as the styloid parts. So 4 parts it has. Okay. So squamous part, squamous means flat. Okay. So that is known as the squama temporalis. So here if you see, this is the squamous part, this is the tympanic part, this is the zygomatic part, this is styloid, and this is the petrous part. Okay. So the zygomatic process that is arises from the lower part of this squamous temporalis, and the zygomatic forms the zygomatic arch. No, so that time the masseter muscle has its origin from that part. Okay. Then tympanic part of the temporal bone lies inferior to the squamous and anterior to the petrous part of the temporal bone. So basically this tympanic part, it surrounds the external auditory opening. If you see here, all around that. So this is called the tympanic plate also. Then we have styloid process. So styloid process lies immediately below this tympanic process. Okay, so below that it will be lying, that is just below the auditory meatus. So to that, 3 muscles and 2 ligaments are attached. The muscles and the ligament attachment together, we call it as the styloid apparatus. So styloid apparatus means styloid process with the muscles and the 2 ligaments attached. So which muscles? Anteriorly, it will be styloglossus on its anterior surface. Medially, it will be, anteriorly, styloglossus. Medially, stylopharyngeus. Okay, and from the tip, we'll have the stylohyoid muscle. And then we have from the lateral surface, we have the stylomandibular ligament attached. And from its posterior, we have the stylohyoid ligament attached. So that is how it forms a styloid apparatus. Then the petrous part of this bone, that is the petrous means stone-like, okay, because it is a very hard bone here, which we see and irregular, we call it as the petrous part of. Okay, so it is a pyramidal shaped and lies at the base of the temporal bone. And basically, the important thing is it will have the inner ear. Okay, and the middle ear cavity will be onto its lateral side. Okay. Then the temporal bone, it will be articulating with the mandible to form the temporomandibular joint. Okay, it also, the squamous part will be articulating anteriorly with, okay, here you can see the parietal will be there. Okay, then also sphenoid bone, zygomatic process, it will articulate. Okay. Okay. So I will do one more bone and we will stop at that. That is the sphenoid bone. So sphenoid bone is found in the superior aspect of the skull. So sphenoid bone will have the body, okay, greater wing and lesser wing and two pterygoid processes. Okay, so if you see the sphenoid bone, you can see here, this is the body of the sphenoid here. Then the lesser wing is there and this is the greater wing will be there. And these two processes downwards are known as the pterygoid processes, which will have two plates, the lateral and the medial pterygoid. Okay. So the body it will articulate with the ethmoid bone anteriorly, and the superior aspect of the sphenoid, that is the body of the sphenoid, will have a groove. Okay, that is chiasmatic, where the optic nerve will they form the optic chiasma, and there is a sella turcica. Sella turcica will have the hypophyseal fossa, where the pituitary gland is located. Okay, so anterior to that, there will be a small depression, which we call it as the tuberculum sellae. Behind, we call it as the dorsum sellae. Okay, so the greater wing of the sphenoid, here it will extend from the sphenoid body in a lateral, superior and posterior directions. Okay, so in that greater wing, we see the foramen rotundum, foramen ovale and foramen spinosum. The lesser wing, it arises from the anterior aspect of the sphenoid body and it goes in the superior lateral direction. So there it will have actually to its lateral, it forms the lateral border for the optic canal, okay, to which the optic nerve and the ophthalmic artery will be entering. So between that two, I told you earlier, there will be a groove between or a fissure between the lesser wing and greater wing, which is called as the superior orbital fissure. The pterygoid processes, they will be descending. So this is where you can see, this is the optic canal. This is the lesser wing and below is the greater wing. You can see all the three foramina there. And these processes, you will see it in the base of the skull. They are called as the pterygoid process. Okay, so this will have two plates, the medial pterygoid and the lateral pterygoid plate. Okay, so the lateral pterygoid plate gives origin to both medial and lateral pterygoid muscles. Okay, so I stop the class at this point and okay, so thank you for watching Auricle. So for more social content, you can follow our social media handles, that is YouTube, Instagram, Facebook, and we are also on Telegram. And you can download the app on Google Play or App Store. Okay. So until we meet next, thank you.